The goals of this presentation are to increase staff understanding of anaphylaxis and teach practical management, and to increase awareness and understanding that can help support students with serious allergies and potentially save lives. Anaphylaxis is a severe, life-threatening allergic reaction. Symptoms of anaphylaxis progress rapidly, and this type of reaction is considered a medical emergency. Children can have severe allergies to food, latex, insect bites or stings, and medication. Not all anaphylaxis reactions will look the same. They vary from person to person. Anyone with a history of anaphylaxis may have a different reaction than in the past. For example, someone allergic to strawberries may have only had hives in previous reactions, but now has lip and tongue swelling. Also, first-time reactions can happen at any time. A person can develop an allergy to a food they used to eat with no problem. An anaphylactic reaction can involve more than one organ system: respiratory, cardiovascular, skin, gastrointestinal, and nervous. Let's take a closer look at what the symptoms of anaphylaxis could look like. Some commonly seen mild symptoms can include runny nose, sneezing, itchy watery eyes, stomach cramps, nausea, and vomiting. More moderate symptoms can include rash, hives, itching or swelling lips or tongue, coughing, wheezing, shortness of breath, and chest tightness. As symptoms become more severe, the child may have difficulty speaking, swallowing, or breathing, and can eventually lose consciousness. Treatment of an anaphylactic reaction needs to happen quickly and with the proper medication in order to prevent the reaction from worsening. Diphenhydramine, such as Benadryl, can be given orally if the symptoms are fairly mild. Epinephrine can be given by injection, usually with an autoinjector, for more severe symptoms and is considered the gold standard in treating anaphylaxis. Because anaphylaxis progresses very quickly, delaying treatment increases the risk of death. Parents with children who have a diagnosis of anaphylaxis are encouraged to provide the school with an allergy action plan. This plan is filled out by the child's physician with input from the parent. It outlines the child's symptoms and their prescribed treatment. The plan is updated annually or when any changes occur and is kept on file with the school nurse. Now that you have reviewed information about anaphylaxis, are you prepared to react in a real-life situation? REACT stands for Recognize, Epinephrine, Activate EMS. Recognize an anaphylactic reaction. All staff should be familiar with common symptoms of a severe allergic reaction as presented in previous slides. If you recognize a student having a severe allergic reaction, immediately notify the school nurse and call for help. Know where to find the student's emergency action plan and emergency medication. Administer epinephrine. Remember, this is the drug of choice for treating anaphylaxis. Epinephrine is available in autoinjector forms under several brand names as well as generic. The most commonly seen autoinjectors in the school setting are EpiPen, Adrenaclick, and Auvi-Q. Each of these injectors are available in regular and junior strength for smaller children. Unlicensed school staff who have been trained by a Plano ISD nurse may administer a student's own epinephrine autoinjector to them. If a student does not have their own emergency medication or no diagnosis of anaphylaxis, only the school nurse may administer stock epinephrine from the school clinic. Activate EMS. Whenever anaphylaxis is suspected, even if you are able to treat with emergency medication, always call 911. Anyone who is experiencing anaphylaxis requires EMS transport because they will most likely require treatment with additional medication as well as close monitoring for continued symptoms. Remember these key points. Anaphylaxis can happen anywhere. Be vigilant. Be ready to react. Time is critical, so act fast. Epinephrine is the first line of treatment for symptoms, and talk to your school nurse to learn more about anaphylaxis. Additional training is available for all school staff on the PISD Health Services Employee Training website. Click on Anaphylaxis to view additional information as well as instructions and videos on administering emergency medication. This presentation was to provide you with basic knowledge needed to better understand anaphylaxis, recognizing symptoms, and how to respond in an emergency. Any additional training that is required will be done by your school nurse.